As a retired anesthesiologist, Dr. Caryl J. Guth dedicated more than 35 years to providing such excellent care and attention to the personal needs of her patients that a large retinue of patients developed who scheduled their surgeries around her availability. Following a personal traumatic neck injury that was helped only with holistic medical applications when traditional medical treatments had failed her, she developed a special interest in helping others also benefit via holistic medicine practices. Her interest in healthcare was ultimately driven by a desire to help others, as well as to serve as a positive role model for women during a time when women as physicians in healthcare were uncommon. At the start of her professional journey, Dr. Guth earned an Associate of Arts from Mars Hill College before matriculating at Wake Forest College, which later developed into a university. Here she became an award-winning student athlete and received a Bachelor of Science in 1957 and a Doctor of Medicine in 1962. By 1965, she completed both her medical internship at the University of Kansas Medical Center and residency in anesthesiology at the University of Pennsylvania Hospital, at which point she returned to Wake Forest Baptist Medical Center as an anesthesiology instructor. Progressing as a medical professional, Dr. Guth sought additional postgraduate training in anesthesiology at Queen Victoria Hospital in Sussex, England. Much later, to keep abreast of updated techniques, she was rewarded proficiency privilege training at Stanford University. During her European stint, she was also an instructor at the University of Nijmegen, now known as Radboud University in the Netherlands, until joining the California-based Santa Clara Kaiser Permanente Hospital as chief of the anesthesiology department. Most recently, Dr. Guth has chaired the Department of Anesthesiology within the Mills Peninsula Hospital System, where she first began her tenure in 1967. Since Dr. Guth's retirement as an anesthesiologist in 2002, she has focused on holistic concepts and preventative measures for healthcare, seeking outcomes of general wellness with an emphasis on healthy lifestyle and chronic pain management techniques without the use of opioids. A diplomate of the American Board of Anesthesiology, Dr. Guth was also known for having served on the board of directors for Mills Memorial Hospital in San Mateo and for Mills Peninsula Health System in Burlingame, California. She was a member of the Board of Science and Policy Advisors for the American Council on Science and Health and served in numerous roles for organizations such as the American Society of Anesthesiologists, the California Medical Association, the San Mateo County Medical Association, and the California Society of Anesthesiologists, for which she served as president. Since retiring from practice, Dr. Guth has remained active in advocacy issues and promoting the integration of holistic concepts into teaching and medical practice. With her endeavors and through a generous gift toward the endowment of the Caryl J. Guth, MD, Chair for Integrative Medicine at the Wake Forest School of Medicine, Dr. Guth is honored to be considered the founder of the service. This visionary investment eventually led to the establishment of the Center for Integrative Medicine of Wake Forest Baptist Medical Center, officially designated in 2009. In 2017, the Integrative Medicine Patient Clinic was established to treat chronic pain patients without opioids and other chronic medical problems without drugs. Reflecting upon her career, one highlight that stands out for Dr. Guth is being recognized by her California Society of Anesthesiologists colleagues in 2006 as deserving of a Special Distinguished Service Award in appreciation for her leadership and accomplishments. Among numerous other accolades, she was honored in 2022 with the new women's basketball complex named the Dr. Caryl J. Guth Women's Basketball Clubhouse at Wake Forest University. A few years prior, the women's wing of the Haddock House of the Arnold Palmer Golf Complex was named the Caryl J. Guth MD wing. The university has also granted her induction into the International Leadership Circle in 2021, along with previously receiving the Loyal Deacon Award and the Deacon Club Member of the Year Award in 2010. During her undergraduate days, Dr. Guth won the Crisp Casey Award for Best Female Athlete. She was also named Distinguished Alumna of the Year Award by Mars Hill University in 2012. Additionally, the Wake Forest School of Medicine awarded her the North Carolina Baptist Heritage Award, and the Medical Alumni Association bestowed her with the Distinguished Service Award following her term as president. Grateful for her various honors and accolades, Dr. Guth notes the most rewarding aspect of her career has come from gaining the trust of people who suffer from chronic body burden issues and providing them hope for improvement, then witnessing their joy as they overcome long-standing problems. She is grateful for having the ability and privilege to help improve people's health and change lives. To achieve such professional success, she credits the exceptional leadership qualities of both of her parents. They stimulated her to realize there are no limits placed on achievement. She has since learned achievement often requires one to step out of the proverbial box and dare to be different, yet bold enough to ignore criticism as one deviates from the path of the status quo toward progress. Additionally, one must recognize the hidden values in suppressed quality research. She also recalls Dr. Jerry Nudell, as president of the California Society of Anesthesiologists, encouraged her to accept leadership roles and nurtured her through them when she had not previously considered them attainable. Presently, Dr. Guth is focusing on chronic pain relief and the prevention of chronic health issues, working with researched natural products that help detoxify our body burden, which has been initiated by our modern polluted environment and now impacts health and healthcare costs. Thus, by relieving the body burden of epigenetic toxic chemicals and heavy metals, enhanced cellular healing may occur, reducing chronic medical problems and needs for medications and their associated numerous and unwanted side effects.